If you're looking for hair transplant, essentially you have two options. Either you can go for follicular unit extraction, which we do at our clinic, or you can opt for strip surgery. And strip surgery then has two options. You can have a strip surgery without having a FUT, follicular unit transplant. If the strip is cut into smaller pieces, but the follicular unit is not respected in that dissection, then it's not a FUT transplant, it's just a strip surgery. And if the follicular unit is respected and the dissection is accordingly, then we talk about a follicular unit transplantation, follicular unit transplant, strip surgery. FUE is the least invasive method of hair transplantation at all. It leaves less scarring, and in many cases you can hardly see any scarring if it's done properly. While strip surgery, even in the best of cases, you will see a strip scar. You cannot do a strip surgery without a strip scar. In some patients it can be really bad, and I have seen some strip scars that were quite okay. But FUE, in far most cases, if it's done by a doctor or surgeon who takes pride in his or her job, you will hardly see any scarring at all, even if you want to wear your hair short. Now, there's another difference between these two treatments, apart from the linear scar that you see with the strip surgery. There's one more difference that's important to remember. Strip surgery is a process where you take hair from the back of the head and you might go into the sides of the head. With FUE, essentially the whole body can be used as a donor site. Any hair-bearing part of the body can essentially be used. At our clinic, we use mostly the scalp, we use beard, chest, we can use the back. We have also used other parts of the body, including the genital areas. So we have a much greater donor availability, and it still doesn't leave the scars that we see with strip surgery. So I think it's quite clear that I'm more in favor of FUE than strip surgery, certainly, and I just believe that if you can have a treatment that restore your hair surgically without having a strip scar where you have to take that into account when you go to the hairstylist, then I think you should certainly go for that. It's quite interesting if you look at me right now. I've had beard hair taken from this area, and I've had many patients in the consultation, and I've asked them, so can you see anything different, anything unexpected, something that doesn't fit in with me? And obviously I'm looking for them to be able to see my scars, and I've not had one single patient who were able to see that I actually have used the beard area below my jaw as a donor area, and I've used it twice. So I think that's quite fantastic. If it's literally in your face and you don't see it, I think that speaks volumes to how nice this surgery is. Anyhow, if you want more information about surgical hair transplantation, then do check out our link. You can have more in-depth comparison between strip surgery and FUE. That's all for now. Thank you.